Hey everyone, it's Lisa here with Hope for STD. It's time for another clinical trial education video in honor of World Sickle Cell Day, which is June 19th. It's coming up on us fast. And today is for all the adult ladies. So this trial is studying bone health in sickle cell, both actually sickle cell trait and sickle cell disease. So the qualifications are you have to be 18 to 45, and they're accepting healthy volunteers that either have actually you can just be a healthy woman, have the trait, or have any type of sickle cell disease. The caveat is that they are looking for people that self-identify as African American specifically, and then you also have to have regular periods and not be on any type of birth control, not be pregnant, not be breastfeeding, and not be less than 3 months postpartum. There are a couple of other kind of unusual exclusions that you might check out. You follow the link in the comments below for the full clinical trial information. It's based in Connecticut, but it is national. There are study sites all over the country, and their objectives are, and I'll just go over it quickly and then explain it, does hemoglobin genotype affect bone health and density? And so what they're really looking for is a couple of things. One, does having sickle cell trait cause earlier bone thinning than would be expected? So they have this hypothesis that potentially just having the trait itself, even without having any complications just with the trait, just being a carrier, might naturally predispose you genetically to having earlier bone thinning. All of our bones kind of naturally thin with age, but they suspect that that might happen at a younger age with women who have sickle cell trait. And so then what they also want to find out is they know that people living with sickle cell disease have thinner bones and have problems with their bones. And what they don't know is specifically why. So why do they have thinner bones? Is it because there are two hypotheses. One, that you're not making enough bone just in general. Or two, that after the bone is made, you're losing density afterwards for a variety of different reasons, and they're not really sure exactly which one it is. If you're just not starting out with a whole lot of bone and then things are thinning over time with avascular necrosis and things like that, or if you have the same amount of bone being produced as just a healthy volunteer with no trait and no full-blown disease, and then you're just losing it at a faster rate because of complications. So those are the things that they're looking for. What they're asking you to do, and this is actually for whether you're a healthy volunteer and you have no trait, whether you have sickle cell trait, or whether you have sickle cell disease, they're going to be doing what they call a bone density evaluation, which is a special kind of an x-ray, usually on your hand to check, or your hip to check the density of your bones. Blood work, which feels like anything to do with sickle cell always involves giving some of your blood. And then they're also going to be asking you to track how much calcium you take in your diet, and also how much burden of pain you're experiencing. So if you do have any kind of bone density problems, such as avascular necrosis, pain in the joints and hips and some decreasing of your bone density, what kind of pain is that causing you? So those are the things that they're looking for. It's a pretty short trial once you're involved, and it's sponsored by the University of Connecticut Health Center. Again, I will tell you that it is national. There are different sites there. And the contact is, I'm so sorry, is Kira Tulane Ollie. I will spell that perfectly for you down below. Phone number is 860-679-7648. Posted everything down below here so that you can check that out. And if you're a female between the ages of 18 and 45 and you identify as an African American and you're healthy, have the trait, or have the disease, then you can participate. Stay tuned tomorrow when we go to one that's at St. Jude's. Thanks. Have a great day.